Hello everyone, and happy birthday UHD. Yes, it's been exactly 1 year since Poole Hospital joined with the Royal Bournemouth and Christchurch hospitals to form University Hospitals Dorset, and hasn't time flown. Our journey together began several years ago when it was first agreed that we could serve local people better by collaborating rather than competing. Over time, we developed a clear shared vision for services that involved using our sites very differently, and we knew that we could best achieve that vision by coming together to establish one new organisation. We've always known that as UHD we could deliver better quality services with a better experience for our patients, a better experience for our staff, and most importantly, overall better health outcomes. All of this was very clearly demonstrated in our response to the COVID-19 pandemic, and there's no doubt that we've been far more resilient over the past year as one large merged organisation. So 1 year on, and I couldn't be more proud of our organisation and all those who work within it. Let me start by paying tribute once again to the dedication, courage and hard work of all our staff in dealing with the COVID-19 pandemic. You've all been incredible, and you should be so proud of the care that you've provided under such difficult circumstances. But I'd also like to thank all those who worked so hard over the same period to integrate our services, establishing the new care groups, the new clinical directorates, bringing together teams, developing new policies and agreeing new ways of working. And I'd like to thank all those who've stepped into new leadership roles, the people who'll be overseeing the transformation of services going forwards. I'd also like to thank all those who've worked so hard to develop the values within UHD and have publicised these so widely. This has been really helpful in attracting people to Dorset. We've appointed lots of new staff over the past year, and at every interview we ask them their views on our values and how they'll support us in embedding them within our new organisation going forwards. Finally, I'd like to thank all those who've kept their eye on the ball in the midst of so much turbulence so that we've been able to keep going forward with our estates transformation. And of course, it's the transformation of our sites that will allow us to deliver new models of care in the future. It won't have escaped your attention that building work really has now started in earnest, with all three of our sites having an exciting and positive future. We shall be continuing to develop Christchurch Hospital. We've started the theatre complex at Poole Hospital, and of course at the Royal Bournemouth Hospital we've started to dig up the car park and clear the space where we're going to be setting up our new emergency care, critical care, maternity and children's facility. And today, on the birthday of UHD, I'm delighted that we've been able to announce that the new big build at Bournemouth will be named the Beach Building when it opens. This acronym stands for Births, Emergency and Critical Care Child Health. It was originally suggested by Lisa Stooks in our library team, and a fabulous suggestion that it was, Lisa, one that's been enthusiastically supported by our staff and by all interested stakeholders, and of course now it's been endorsed by our board. Looking ahead, I know that our organisation will continue going from strength to strength. As a university hospital, in partnership with Bournemouth University, committed to teaching and research, with a strong set of values and a positive culture, we shall be able to continue recruiting and retaining high calibre staff. And of course, it's the people that make all the difference to the quality of care that we can provide every day. On top of this, University Hospitals Dorset is absolutely committed to the development of the Dorset integrated care system. We know that patients are best served when partners work together to integrate and join up services. So we expect to play a very active role in establishing the Dorset ICS, ensuring that it delivers the best use of our collective resources and achieves the very best outcomes for local people. It's been a really exciting and challenging 12 months within UHD, and I'm so proud of all that's been achieved. We're now looking forward to delivering even more over the next few months and years and playing a really important role in creating a positive future. Let me close, as always, by thanking everyone once again for all that you do every day for our patients. I want to thank all our staff, our volunteers, our fundraisers, our members and our governors. Together, we're Team UHD, and we're doing it all together to create the very best future. Thank you.